Hello everyone and welcome back to What After Dentistry. Now today's video is a very requested topic on how to practice dentistry in Australia after BDS or MDS. So here we are with the entire application process, the cost required, the time and other details. And to discuss this today, we have with us Dr. Henna Kainth, who graduated from KD Dental College, Mathura in the year 2009. During her graduation, she did a basic course in dental implantology and then she went on to work in Safdarjung Hospital, New Delhi in the year 2010-11. Dr. Henna has also been conducting online coaching for the Australian Dental License Examination since 2010, wherein she caters to the dentists across the globe who aspire to practice in Australia. She has helped hundreds of dentists in the past decade and is one of the pioneers to provide online support for ADC examination by the name of ADC Aspirants. In addition to her profession, she has also forayed into the fascinating world of beauty by winning the crown in Mrs. India Worldwide 2015 pageant held in Bangkok with the finale in Myanmar. Dr. Henna has offered several interviews on self-grooming and has conducted various grooming and personality development programs for women. So let's hear what she has to say about how to practice dentistry in Australia after BDS. Hi, Dr. Henna. We welcome you to our channel, What After Dentistry, and it's a pleasure to have you on our channel today to talk about how to practice dentistry in Australia after BDS and MDS. So welcome you once again.
Thank you so much, Dr. Shireen, and the pleasure's all mine, believe me. I think your channel is fabulous. I had the privilege of going through a couple of videos, and I think you guys are doing a wonderful job. It's the need of the hour for all the dentists across the country right now. So thank you for that.
Thank you so very much for your words. So, before we start into the formal discussion of how to practice, what's the application process, and so on and so forth, we would like to know a little more about you. How has been your journey in dentistry so far?
Well, the journey, as I must tell you, it's been pretty exciting. See, I started off as a normal dental graduate would. I finished my graduation and then I got the opportunity to work in Safdarjung Hospital, New Delhi as a junior resident. And after that, got married, joined my husband in his private practice. And, everything was going on smooth and is going on smooth, touch wood. But in the year 2011, I had decided to go ahead with the Australian Dental Council examination, and I cleared the part one process of it. Somehow, due to some personal reasons, I did not pursue, but I realized how little information there was, and how there were no mentors back then to tell candidates exactly about the process and what to study and all of that. So I decided to start my own coaching, online coaching, so I could help not just candidates in our country, but across the globe. So the journey has been pretty exciting since then. This has added a new tangent to my, dental journey so far.
That's amazing. That's great. And as you said correctly, we do not have a lot of information as of now. Even today, I mean, like only for specific countries, we do have the information now because many people have moved out. And like you started an initiative, we also thought of starting this initiative of informing people.
Exactly.
So yes, now we are coming up with the information, and I can totally comprehend with you. So yes, absolutely, that's great, and congratulations to start out with this and provide candidates on the information that is actually required. So
thank you.
Yeah. So we would like to understand what is the step-by-step process if one wants to practice dentistry in Australia after BDS.
All right. So I would like to tell you here that a candidate, whoever wishes to practice dentistry in Australia, has to have a valid registration in their own country. Now, I'm going to be talking about a dental graduate, not just from India, but like I said, across the globe. All right. So the valid registration has to be there. They have to have their dental license in their own country. All right. So that needs to be completed. And first step is applying for the initial assessment, which is, you have to procure a list of documents from, it can range from the transcripts to your valid registration, your internship completion certificate, and a few others as well. All the information about these documents are given on the ADC website. And once that step is done, a candidate needs to post these to the ADC. Please remember here that the documents have to be posted and not emailed. All right. So once ADC approves the initial assessment, they take usually around 6 to 8 weeks time. And once that is done, a candidate is eligible to appear for the Part 1 examination. All right. So the Part 1 examination is basically your theory examination. It consists of all multiple choice questions in the form of scenario-based questions. And this examination is held twice every year, in the year of March and in the month of March, and in the month of September. All right. So the dates, there are certain window dates which open when a candidate has to fill up the application form and again courier it to or post it to ADC. And once the results of the Part 1 are out, which usually takes around 1.5 months, you have the opportunity to sit for the practical exam. Now, I would like to point out here, Dr. Shireen, that the Part 1 exam is held, the theory exam is held all over the world. There are various centers. All right. So many candidates usually believe that they need to travel to Australia, which is not the case. All right. So once that part is completed, the Part 2, which is the practical examination, is held only in Australia, in the city of Melbourne. All right. And that's a 2 days process. It consists of various technical tasks and vivas. So the validity of the result for the Part 1 is around 3 years. So a candidate needs to, clear the exam within this 3 years window frame time period. Yeah. So after that, you can give your English exam. English proficiency exam can be given before your Part 2, or it can be given after your Part 2. Many candidates, they choose to give it after because they think that, the validity is there for 3 years. So why not get done with ADC first and then sit for it? So there's occupational English test, there's IELTS that can be given, and a couple of others. So all this information is out there, but yes, this is the step-by-step process for applying for the ADC examination.
Okay, I think that's fair enough. And how soon can a dentist start with this process? Like, in terms of, is there any clinical experience in number of years required for the clinical experience before they start with this application process?
Well, the best part about ADC examination, Dr. Shireen, is that contrary to the popular belief that you need to be a skilled, practitioner and you need to have a couple of years of experience, there's nothing of that sort which is required. I've had candidates, who have taken my coaching and they have just graduated. Like they have just completed their internships and they appeared for the ADC Part 1 examination. And they actually consider 1 year of internship also as an experience. So that's a good news for all the aspirants out there.
So I think somebody who's in the internship, they can start preparing, and as soon as they're out of the internship and they get their registration done, they can start with the application process.
Absolutely. That's what I tell all the candidates, that if you are in internship right now, do not waste your time. At least start the preparation, because with ADC, time just flies.
Absolutely, absolutely correct. So all you BDS graduates, if you're interested to practice, dentistry in Australia after you complete your BDS, then if you're in internship, make sure that you start the preparation process. You can start with the application once you're out and you get the license, the registration done. Before that, utilize your internship year to fully prepare for the examination, Part 1 examination, as Dr. Henna correctly said. So, next we would like to know, like you mentioned that, you provide coaching for ADC examination. So one is that, students can go with the coaching centers. Is there any other way route Like, are there books available? What are the kind of questions that they need to prepare for the ADC examination?
Yes, of course. So, Dr. Shireen, the thing is that, for ADC, one needs to have a very strong clinical knowledge. I would like to say, point out here, ADC does not ask you questions on anatomy, biochemistry, physiology, and all of that. Basically, our first year subjects, what, we read during our first year. So it's a very, application based examination. So they will give you scenarios. First of all, let me just cite an example, a very small one, that a patient walks in with a pain in the lower right molar, and he will give you the entire history and the symptoms. So the first part of the scenario will be what is the most appropriate test which needs to be done in order to reach a diagnosis. Now, if the test is done, the second question would be, what is your provisional diagnosis based on this, based on the history given and the symptoms given by the patient? So, such 4 or 5 questions will make up one scenario. Now the candidates, usually they are lost between what to study and what not to study. So I tell them there are a lot of books which have been mentioned by ADC on their website. If you start reading them, I think you'll take probably years altogether. So there are certain things that you need to focus on. For example, for pedodontics, there's Cameron. They follow it blindly. For pharmacology, there's therapeutic guidelines, which has to be read from top to bottom. So just like these, there are many books, but what we do is we make very comprehensive notes. We have done that over the past 10 years now. We provide notes to our candidates. We give them a timetable to follow. We give them regular mock exams. So what happens is they are on the right track. So they know that, we have to study this and we have to ignore this. So that's the kind of preparation which is required for ADC, completely clinical based.
That's fair enough. And then when we talk about, you mentioned that all the examination centers for part one are basically in the they are spread across the globe. So do we have
Yes.
centers in India also?
Many. I think India has the maximum number of centers, to be honest, because there are so many candidates from India who are applying every year. And I think I also have the maximum number of candidates from our country. There are, people who are settled abroad, Indians who are settled abroad, etc. But in India, you have in Delhi, Chennai, Bangalore, Chandigarh, I suppose, and Pune. Yes, so many centers out there. Yeah.
Okay, that's great. And for part two, if somebody has to go, once somebody clears part one and they have to go to Australia to appear for part two, what are the best visa routes that are available for such kind of candidates?
Okay, so Dr. Shireen, I would have to, answer this question in a way that we can talk about, pre-COVID times and post-COVID times. Things were pretty much simple and straightforward pre-COVID. As you know, the situation right now, the flights have been cancelled, and they are just allowing their own citizens to travel back and forth. So up until now, a candidate who could clear ADC till 2019, I'm talking about before COVID times, they had to practice for 2 years and then they could get a PR. And the visa 489 was valid, I think, up until then. But now things have changed. There's a lot of delay in the process. Exams are still happening, but the visa processes will continue to change. So I think it's best for candidates to find out about this from various agencies online, who can give them, a much more authentic information.
Right, absolutely. I just wanted to know, can somebody go on a travel visa? Is that allowed to prepare for to appear for the examination, or still somebody has to go through the agency and then ask? Or
No,
no?
no. If for the examination, you can definitely go for. I think you get a visa for 1 week or so for the just for the examination. But again, this is what This is about the times when COVID had not happened. So now the examination is there only for candidates who are in Australia. So there's a certain backlog also because of this. But definitely, before COVID, people were going in, candidates were going in, given the exam based on a travel visa itself.
So I think that's fair enough. And all the audience, if you still have confusion related to the visa routes that are available for you to appear for the examination, once you clear the examination, how to get the licensure and everything, it's always a good idea to go through a recruitment agency or a place, all these agencies, immigration agencies basically, and ask them, because they are the right people who can guide you in the direction for getting the visa rules which are applicable in terms of immigrating to Australia to practice dentistry. So, like after clearing part one, how can somebody prepare for part two? Like you mentioned, part two is a clinical based, it's a practical examination. So basically, they're going to
Yes.
test the clinical skills of the dentist. So how can one prepare for part two?
All right. So, Dr. Shireen, what happens is in the part two examination, like I said earlier, there are 2 days. Day one can be either your technical tasks, which include complex amalgam restorations, composite restorations, caries preparation, and a couple of others, provisional crown making, etc., crown preparation as well. And day two, the next day, can be your OSCEs, wherein the examiners, they will act as patients and they will put forward a scenario, and the candidate has to act as the dentist, and they have to answer the questions which are posed by the examiners as patients, right? So what has happened now is, up until now, of course, there were there are a few centers here in India also which provide very good coaching for the part 2, and of course there are various centers in Australia. But now, because of COVID, again, there are many online such coachings happening which are really worth it. And we tell our candidates, when they reach that stage, we definitely guide them through it. And it's not like there is a scarcity of such things right now, such coaching centers. So online also is a good option for people who want to sit at home and practice. So you need basically a home setup, something like a home setup where you can practice on typhodons and you can have a phantom head. So all this information is provided by the coaching institutes which guide them for the part 2 examination.
I think that's fair enough, and that's a good thing, because part two, I'm sure, theory examination you can read and you can understand it. It's easy to clear if somebody is a good, focused student.
Yes.
But for part two, because clinical skills, what we have as compared to, of course, what Australian Dental Board will be practicing will be very, very different. So what they will be expecting is something very different. And it's a good thing that there are good coaching institutes, as you mentioned, which can help you prepare for part two examination.
Yes, absolutely.
So now, if somebody clears both part one and part two examination, what is the next step?
All right. So let's say a candidate has successfully cleared the part one and the part two. What the next step is, that, like I mentioned earlier, you have to clear the English proficiency exam also. You need to get, I think, a band of 8 or more if you're giving IELTS. And if you're giving the occupational English test, you need to get at least an A, B, or a C grade. There are 4, parts in that: writing, speaking, and 2 more are there. So reading, of course. And once that is also done, you need to go to Australia, get yourself registered by the APRA, which is the Australian Health Practitioner Regulation Agency. That institution or that agency gives a candidate the license to practice in Australia, and that is renewed every year. All right. Once that is completed, you are eligible to practice dentistry in Australia. That's the end of the ADC examination journey.
Okay. And how easy it is to find a job or to get the work in Australia once you get the licensure?
Well, Dr. Shireen, I would be very honest here. I wouldn't say that, as soon as the candidate clears the exam, the jobs are offered on a platter and, you are called and all that. No, it's it's a very, it's totally dependent upon the skills of the dentist as well. How confident you are. Definitely what we suggest is that you should start with, practicing with somebody rather than just independently going into a practice initially. And it's not difficult at all. It's the see, dentistry all over the world is the same. If a GIC is done here, a GIC will be done there the same way. If an amalgam is done here, an amalgam will be done there. So it's all about your experience, how much you grow. So I think I have seen in my 10 years of coaching, I've seen my candidates getting jobs within 1 month also, some of them getting jobs within 5 months, 4 months. But I don't think anyone gets a job more, a long time after clearing the exam. They get jobs easily, and especially in rural areas, like in the main cities, definitely it can be a little difficult, but in the countrysides, it's quite easy. It's not that difficult.
That's fair enough. And so, is the process same for an MDS graduate also?
Yes. So anyone who has done post graduation here or anywhere else in any other part of the world, they have to go through the same process. They have to give the general dentistry exam, which is the ADC examination.
Okay. And can they specialize there, or can they work on the specialty that they have once they clear with the examination and they get the licensure, everything? Can they practice the specialty?
They can practice the specialty, Dr. Shireen, but they cannot, probably write it on paper that they are a specialist in this field, probably. But I've seen many people who have done courses and who have done like, diplomas out there, and they are practicing, like orthodontists are doing orthodontic work, and implantologists are doing dental implants, so on and so forth. So it's not like you cannot practice at all, but probably on paper, you cannot write.
I think that's fair enough. So all you MDS graduates, if you wish to practice dentistry in Australia, then you have to go through the same process, and you can practice your specialty, of course. It's just that you need to, it'll take a little time for you to start practicing the specialty, as it will not be there written anywhere on the paper. And as and when you get patients where you can practice your specialty, you can absolutely do so. So then coming to the cost and the time part, because this is again a very, very important question that we get from our viewers, that how much is the total cost required in the entire application process?
All right, so we'll take it step by step. I'll make it easier for your viewers as well to break it down. So the first part, like I said, is the initial assessment. The cost for that is somewhere about 600 Australian dollars. The part one exam is somewhere around 2,000 Australian dollars, and the part two examination is around 4,500 AUD again, right? So all in all, somewhere around 7,100, 7,000 AUD. All right, when you convert it into our currency, it comes out to be, I think, some 3.5 or 4 lakhs or something like that, right? Now, again, I would like to mention here that the fees keeps getting revised. What I'm telling you right now is the current situation. It may get revised very soon. So you need to, all the candidates who are aspiring to give the ADC need to keep checking the website for, the fees as well. So this is what I'm talking about, just the examination. But you have to keep in mind that there'll be certain coachings required, the travel back and forth, English examination, registration. So all in all, when you talk about all of this, easily I think 9 to 10,000 AUD is what you need to have in hand, and you're sorted then. Yeah.
That's fair enough. And how much is the time? How much time does it take for someone to?
All right. So if anyone who is lucky enough to clear both the examinations in one attempt, it'll take hardly 1 year's time, one or maximum 1.5 years time, right? But generally, it's not the situation. People do take re-attempts, so where you have to, give the fees again for that particular examination. For example, if somebody has not been, is not been able to clear the part one examination, they have to give the fees again for part one. If somebody has failed the part two, they need to give the examination fees again for part two, not for part one then, right? So but 3 to 4 years, 3 years is something that a candidate takes on an average. Yeah.
And when you mention about the attempts, how many number of attempts are allowed for each exam?
Unlimited for part one. Again, initial assessment, I would like to tell you, Dr. Shireen, is valid for 7 years. So let's say, for example, I'm eligible to appear for the exam. My initial assessment is complete, which is a complete ball game altogether, because I'll tell you later how they specify what documents are required. So basically, I can give the part one exam anytime, I mean, unlimited times in these 7 years. But then I should make sure that I clear it within 1 year or so that I can give my part two again in the next 3 years. So in these 3 years, I can give as many attempts as possible. It just totally depends upon the candidate, how much time they require and what are the dates available with ADC for their examination. Yeah.
I think that's fair enough. And what are the requirements for internal assessment, as you mentioned?
Yes, for the initial assessment, Dr. Shireen, they are very specific about certain things like the passport size photograph has to be a certain, of certain measurement. And, the notary's attestation has to be very specific. They're very particular about the contact details of the people who are notarizing your documents, and they need the details, the complete details of people who are recommending, who are writing letters of recommendation for you. So these are a few little things where people they tend to be a little laid back. They think, okay, fine, we'll send this, and maybe it'll get approved. But no, that's not the case. So what we do at our coaching is we provide the samples of documents which have been approved by the ADC, and we tell them that this is the format that you have to send to ADC, so that your documents are not sent back, because what happens is then it just delays the process more.
I think that's fair enough. And that's a great thing that you are doing, that provide, because generally you don't get this so much of information and people don't help, so much. They will just say that we are just here to help you with the examination, not with the application or the assessment part. We have seen those kind of, agencies also. So I think that's a
Yes,
great.
Dr. Shireen. Thank you. I must tell you here that I had one or two candidates in the past, I think 2 or 3 years ago, from Mumbai. And they told me that, there were agencies who were charging them 50,000 rupees or 70,000 rupees just for helping them out with this, paperwork, with this initial assessment. I told them, please do it on your own, run around, go to your college, go to your university. You can do it. You don't need to spend that much money. And that's when the idea struck me that why not provide the samples as well. So yeah, you're right about that.
Absolutely correct. Absolutely correct. So, lastly, we would like to know what are the challenges that one can face throughout the application process.
So first of all, like I said, the initial assessment has to be, very, very specific. The documents have to be very, very nicely attested, and all the specifications have to be met basically. The other thing is, for part one preparation, we always tell our candidates, please study whatever is relevant. People tend to feel that, oh, the exam is 1 year later and I should just, probably, I'll start studying 3 months before the exam. But no, with ADC, you have to have at least 6 to 9 months in hand. And I don't advise anyone to study 16 to 18 hours a day. No, you start with 3 to 4 hours a day, and then you increase it slowly and steadily. So these are a few things that aspirants need to keep that in mind. Yeah.
I think that's really great, because that consistency, is very very important, rather than spending the entire day to studying. And you don't retain also. If you just sit for 18 hours, it's not easy to retain the entire information that you have grabbed in 18 hours. So I think that's very very important and well said.
And
So
and we also, sorry to interrupt you, but we also tell our candidates that do not stop working. If you are working part time, you please continue going to the clinic, because that's when you will see cases. You need to see how an amalgam fails, how a restoration fails, why it happens. So if you can relate that to your ADC examination theoretical knowledge, I think that amalgamation would be wonderful. So that is very much required.
absolutely correct. And like working also will help you to deal with patients. Like when you say, when you
Yes,
have to go for part two, it's very important. If you don't know how to do crown cutting, how will you present yourself while you're in the part two?
absolutely.
So I think that's very,
Agree.
very important to keep working, and then of course side by side, prepare yourself, because 1 year I think is a good amount of time to prepare and get yourself through the examination. So all you audience, if you're listening to our session, then please make sure that you have these pointers ready and you have noted these points somewhere, and you work on these points. Consistency, working and then preparing side by side goes hand in hand, and that is something that you should follow. So, your last tip or advice for all the dental graduates who wish to practice dentistry in Australia after BDS and MDS?
Well, Dr. Shireen, to be honest, now in the past decade, I think I have learned so much from my students, and I don't like to call them students. They are all dentists and good, well-skilled doctors. So I like to tell them all that you have to have patience in this ADC journey. You have to definitely dedication, hard work has to be there, but You cannot just jump to one step and to another. There are failures in between, but don't give up. I have seen geniuses who have had to take 2 or 3 attempts. And I've seen average students, average candidates who have cleared it in the first attempt. So don't ever doubt yourself. Just if you've made up your mind that you want to practice in Australia as a dentist, just don't give up and go ahead. And my only tip to everyone out there is woods are lonely, dark, and deep, and you have promises to keep and miles to go before you sleep. So yeah.
That's amazing. That's a great, motivational, thoughts or quotes that you have mentioned for our audience.
Thank you.
All you audience out there, if you're patiently listening to our session, then thank you very much for patiently listening to us. And thank you so much, Dr. Henna, for sharing all the, wonderful information and, putting the information so very correctly in such an organized manner for the audience, that they will be able to understand that how this needs to be practiced and what is the application process for Australia. So thank you very, very much.
Thank you, Dr. Shireen. And I hope that all the audience, all the viewers who are listening to us, they benefit from this talk. And again, I would like to thank you for the wonderful job that you're doing. It's commendable and kudos to you.
So very much. So all your audience, thank you very much for patiently listening. I will also link down the contact details of Dr. Henna, so you can contact her if you want to know more details about the how to apply and what kind of coaching or how to prepare for part 1 and part 2. She's the best person who can help you through that. So I will link down her details below. You can always check out the description box. Before I sign off, please subscribe. It's absolutely free. Like and share this video in your network because this will help out somebody who's planning to move to Australia to practice dentistry after BDS or MDS. I will see you in the next video. Until then, bye and good night.